In this episode, Dr. Lauren chats with Erin Khar, author of Strung Out. Together, they explore principles from her book, sharing practical advice and strategies for supporting loved ones on their recovery journey. This is the Well Aware Podcast.
Hi, guys. Welcome to the Well Aware Podcast. I'm Dr. Lauren Grawert, Chief Medical Officer here at Aware Recovery Care. I'm really excited today to be joined by author Erin Khar, who wrote a book called Strung Out, One Last Hit, and Other Lies That Nearly Killed Me. She's a prolific writer with a lot more out there, but that is her book. And Erin, thanks so much for joining us today.
Thanks for having me. I'm excited to be here.
Yeah. Where does this podcast find you today?
I am at home in New York City in Greenwich Village.
Oh, wonderful. One of the best cities in the world.
I love it.
Can you tell us just a little bit about yourself and your background and your experience with addiction, how you got into writing about addiction?
Sure. So, as a kid, I started keeping a journal at a really early age, and I always wrote, but never really felt like I had the confidence to be a writer. As far as like the addiction component goes, the first time I took an opiate, I was 8 years old. I didn't know it was an opiate. I was having a panic attack, which at the time didn't understand what was happening. I found an expired bottle of Jarvicet in our medicine cabinet and took one and really liked what it did. It gave me sort of a buffer between the overwhelming feelings that I had as a kid and the world. So over the next few years, as I struggled with depression and anxiety and suicidal ideation, when I had those overwhelming feelings, I would reach for a pill. I got into the habit of sort of stealing pills from people's medicine cabinets. I'd store them away. I didn't even know what they were. Anything that had a may cause drowsiness label on it, I would take a couple from the bottle and save them for when I needed them. Fast forward to age 13, as like adolescence hit, and those feelings that I had struggled with became bigger. I found myself reaching for them more and more and was introduced to heroin by a boyfriend. For me, there was no hesitation in trying it, despite things that I'd heard about it. And that set me off on 15 plus years of struggling with heroin addiction. What made my story a little bit different is that I successfully hid it from pretty much everyone in my life for a decade until I got caught by my then fiance at age 23 and went to rehab for the first time. It took me another 5+ years of sort of continual relapsing to get into recovery and stay in recovery. And I now have over 21 years of continuous recovery. So that's sort of the broad view of my addiction component. In my mid-30s, I was at a crossroads in terms of what I was doing with my life. I had a clothing line that I just wasn't passionate about, and I would need to borrow, as we were scaling up, I would need to borrow money to keep it going. On a chance encounter at a brunch and a walk around the city one day, somebody I'd never met before said, "I really think that you're a writer," based on like the stories that we were telling each other. And for some reason, something clicked, and I decided to go back to school and start taking writing classes. And then I started publishing. I started a blog and started my advice column there, Ask Erin. This was 2009, which grew and grew. And I realized that the more I wrote about things that were shameful topics or stigmatized topics or things that I had gone through, the response from people was so great that I realized that there was an opportunity there to combine what I loved doing, which was writing, with also doing something meaningful in terms of destigmatizing the topic of addiction, and perhaps even more importantly, enlightening people onto what it feels like to be somebody struggling with addiction when you don't, quote unquote, look like what people think of when they think of a drug addict. I part of the reason that I was able to hide in my addiction for so long was that I didn't look like what the people in my life thought a drug addict looked like. I attended a prep school. I came from an upper middle class family. I had a lot of financial privilege, and I had straight A's, had a lot of friends. There weren't signs for my parents that there was anything wrong. In fact, there was a period of time when I had stopped using drugs, and that's when sort of the emotions really came out as a teenager. And that was when my parents were concerned and sent me to therapy.
Wow.
It was actually when I was not on drugs. So, that's been sort of my mission in terms of writing about addiction and recovery is really enlightening people. And then on with the benefit of that, as I've grown a platform and been able, had the privilege of doing a lot of speaking engagements with medical professionals, law enforcement, etc., I've had the opportunity to do a lot of advocacy work, meeting with congressional reps and lawmakers about drug policy reform. So that's sort of the overview of me and my addiction story and where it is now.
Wow. It's so inspiring how you took what sounds like a painful upbringing, to say the least, and really have turned it into a higher purpose and a higher cause to help others, like really in a creative, different way. One of the things I like about you talk a lot about understanding addiction as a complex biological disease process rather than a moral weakness or a failing. Talk a little bit more about that and kind of some of the misunderstandings you see in our modern day society with addiction.
Sure. So, I do look at it as a public health crisis, not a moral failing. I think that one of the things that I'm not completely aligned with is in terms of the traditional disease model of addiction. That's not necessarily what I mean when I talk about it as a complex disease, because I think that it is complex. I don't think that everybody who becomes addicted to drugs has the disease of alcoholism in the traditional 12-step sense. I think there are people who do. And I think there are a lot of people, such as myself, whose addiction was really born of maladaptive coping mechanism in response to trauma and unresolved mental health issues. And I've seen that time and time again. I was sexually abused as a child at a very young age. For sure, that is the root of my trauma. And then you add to that some underlying biological mental health issues, and then you have sort of a recipe for disaster. And I think that this, I'm not unique in this. There is a reason that we have an overdose crisis in this country. There's a reason that the drug epidemic in this country continues to grow. And that's really because we are not set up as a society to support people on a preventative level with mental health. And I think that, the vast majority of people who have addiction issues have underlying mental health issues and trauma.
Yeah. And what you're really speaking to, I think, is the importance of treating co-occurring disorders, right?
Yes.
You have to treat the depression, the anxiety, the PTSD, in order to treat the addiction so people can be successful long-term. It's so great to hear other non-medical professionals kind of singing the same song here. The other thing I like about your writing is you talk a lot about the role that family members and loved ones and friends play in the recovery process. You talk about the birth of your son and how that was really a turning point kind of for you in recovery. Can you just kind of speak more to our audience in general about the role that family and friends and allies play in that journey along the way? Whether positive or negative.
Sure. Yeah. I think, I probably came of age in the era of tough love. And I think that tough love does not work for most people. Of course, there are people who say, oh, I didn't get it until I lost everything and I went to jail. But for the vast majority of people who are incarcerated over drug offenses or lose everything, they don't make it back. And for me, it was essential that the familial support that I had, as dysfunctional as the family I grew up in maybe was, they did love me. They didn't turn their backs on me. And when I asked for help, they were there. It was essential for me. I would not have been able to recover without that support. Certainly, the birth of my son was a turning point for me. As you may have read in the book, I was a little ambivalent about becoming a mother. I was using drugs in the beginning of my pregnancy. I found a doctor who detoxed me, and I wasn't sure if I would be able to stay off of drugs. I knew I could do it for the duration of the pregnancy.
Mm-hmm.
But there was a moment for me when my son was born, the second that I looked into his eyes, there was just this overwhelming feeling that for the very first time in my life, the love that I had for this child was greater than the self-hatred I had. I just loved him more than I hated myself. Now, that did not sustain my recovery. It was a starting point.
Mm-hmm.
And I was fortunate enough that I had access to good mental and physical health care. I had family and friends who supported me. And that made all the difference in the world. You know, the first, say, 5 years of my recovery, I still struggled with a lot of mental health issues in terms of sort of my emotional regulation skills, which I don't know any adult who has perfect emotional regulation skills, but they are certainly far better now than they were 21 years ago. And that is really key. You know, I think that as helpful as like a 28-day inpatient rehab program can be in terms of removing you from your environment and kind of giving you a foundation to start again, really, you know, I went to rehab twice. That's not what did it for me. It was really the long-term mental health care plan. And that is a very individual thing. Mm-hmm. Everybody, you know, is going to need something a little bit different. You know, I say this a lot, and I'm not the only one who said this, but there is not a one-size-fits-all treatment for addiction. And I think that in terms of how the medical community has been set up for many years, in terms of how the legal system has been set up for many years, the path has been following like a 12-step program that works for many people, but for many more, it does not. And that's why I think that the increase in medicated assisted treatment for folks is essential,
mm-hmm.
just essential. You know, the statistics in terms of success rates for people who enter some sort of treatment through a harm reduction program, the success rates are so much greater.
Yeah,
so much greater. And there's a reason for that, you know, and I think it's it's sort of like a nuanced effect, part of it being that they're treated as human beings first, regardless of whether or not they are using drugs. And that's key.
Yes.
Because addiction is just one of many human struggles. It is part of that is a very human experience.
Yeah.
And I think that's something that's important to recognize. And fortunately, I think that we are moving in that direction in terms of the medical community, in terms of the legal system, the legislative system. So that's encouraging.
Yes. What do you say? You know, I talk a lot about harm reduction as well and moderation management. And one of the most common pushbacks I get, and I'm sure you've heard as well, is, oh, well, you're just encouraging them to keep using drugs. Mm-hmm. You're just condoning this bad behavior, maladaptive behavior. Mm-hmm. I have lots of different responses for that. But what do you tell, family members who are saying, oh, you're just saying they can go out there and keep using? How do you approach that?
So I'd say that you have a choice with a loved one, right? You can do everything you can to make sure that they stay alive, or you have a high likelihood that they will die. Mm-hmm. I do a lot of speaking with parenting groups and frankly, with like young people about harm reduction. My son, my older son, when he was going to college, before he went to college, during high school, we did a naloxone training. I always make sure that he has naloxone and fentanyl testing strips, and now xylazine testing strips. And at first he's like, rolling his eyes at me, and he's like, Mom, I'm not going to. And I said, it doesn't even matter. I said, of course, right now you say that, but like the likelihood that at some point you may try something is high. The likelihood that somebody may try something is high. It takes very little time and effort to test drugs. And with fentanyl and xylazine infiltrating not just the heroin supply, but it's in Molly, it's in cocaine, it's in what people are buying as ketamine, pressed pills. I speak to parents more frequently than I like who've lost a child because they took something that they didn't know had fentanyl in it. And these are not even kids who were struggling with addiction. These were kids who were experimenting. And whether we like it or not, most kids are going to experiment. And I promise you would rather give your kid the tools, the harm reduction toolkit to stay alive. It's better that you have a kid that experiments with drugs than to have a dead kid. And as long as somebody's alive, there is a chance for recovery. If they die, there is no chance for recovery. It's essential for people to have connection to a community, particularly family members. And I also say that there is a difference between cutting somebody out of your life and having boundaries. And what that looks like is that you don't need to give somebody money and say, oh, here, go buy drugs. However, you don't deny them anything else. They want a meal. They need some kindness. They need medical care. If you can provide that, provide that. Provide them a non-judgmental place to go. And that saves people's lives. I have seen people time and time again. I have lost so many people in my life over the years who were cut off from their family. And there is a point at which it is very difficult for people to come back when they feel like there is nothing to come back to.
I love that, the way you summarize that, of just providing a non-judgmental place to go, a very neutral place, and how key that can be. And, the xylazine, I've been reading some articles. It's because it's clear, it's being spiked in even alcohol drinks and bars. I mean, I love how you approached those tools with your son from a preventative perspective, rather than in a situation where you already had concerns or were worried, but just preventative, almost like, sex education in 7th grade. Like, here are the tools, here's what you need to know. That's great. Is there anything, you talk a lot about kind of the role your family played, and particularly your mother, looking back on your own childhood and your recovery journey. Are there other things your parents did that you think really made a difference for you or helped you, in addition to that kind of unconditional positive regard?
I mean, I think I had a complicated relationship with my mom growing up. We were really enmeshed. And one of the things that always stands out to me is when I was just before I turned 15, when I stopped using drugs for a period of time, and I was really feeling I was so volatile. I just could not control my emotions. I had started going to therapy. My mother was in therapy as well. And we did family therapy. And in family therapy, she allowed me to express all of the hurt that I felt and was not defensive and didn't come up with excuses. There was no, but she just let me talk, which I'm sure was extremely difficult, because I know as a parent, we're all going to make mistakes. There is no parent alive who's gone through parenting without making a mistake. And I think that as a parent, the learning how to say that you're sorry to your children and to apologize when we make missteps is key. And I remember that my mom sat there and she just said, "I'm so sorry. I cannot imagine what it must have felt like to feel that way." It was so profound. Did our relationship get fixed overnight? No, but it continued to improve over the years. And I see everything, I see like my recovery journey. I see my relationship with my parents. I see my mental health. Nothing gets solved like this. It is a trajectory. So you're going 3 steps forward, 1 step back, but you're continuing to move forward. And a big part of that was my mom validating my feelings. And just her saying that she was sorry made me feel like, oh God, I'm not crazy. This is what I felt was valid. And especially when you're a kid, it can feel often like what you're feeling is invalidated, because I think it's challenging for parents to confront when they've made a mistake.
Right. Yes. I mean, yes. Like, how do you, it sounds like what you're saying, and I see too, parents, how do they say I've made a mistake and also have that regard as being a role model and their kids still looking up to them? And I think your story, very poignantly points out that showing emotional vulnerability as an adult, as a parent figure, showing vulnerability, admitting mistakes, really is a powerful, positive example for children and permission, right? Gives them permission. I think you have a column that's even like, I give you permission, but gives folks permission to learn how to be vulnerable themselves. That's
right. Because I think what happens so often, and I think is, I see this a lot where there is, if you don't ever see your parents own up to a mistake or be open with you about failures they've had, whether it's a failure as a parent, failure in their relationships, failure with their work. When we do that, we give our children the gift of understanding that this is just part of life. It makes us who we are. It builds our character, and we see then, like, that our character is not made up of the mistakes we made. It's made up of how we reacted to those mistakes and how we rebuilt after those failures. That's priceless.
Yes.
The shame of failure, the shame of mistakes is what drives people often to maladaptive behaviors.
Right. Yes. So true. It reminds me, I'm a big podcast fan. I heard a podcast with Anthony Scaramucci of all folks, a couple of weeks ago. And he was saying, regardless of if you're right, left, middle, right. When he was in the White House, when he got kicked out of the White House for 11 days, his adult kids came to him and said, "Are you going to be okay? We're worried about you." And his perspective was he had shown vulnerability over the years, and he had so many times where he said, I messed up. I feel bad that they felt like they had permission to say, "We're worried about you. We've seen this. Are you going to be okay?" That whole arc. So, man, I could talk to you forever. As we're wrapping up here, thank you so much for sharing your story, your honesty too, and your vulnerability. Before we wrap up, any final thoughts or takeaways for our listeners that we didn't cover or you want folks to remember?
I think that the most important thing is that when people do things that feel unimaginable to us, that we remember the human being underneath whatever it is they're struggling with. Because when we do that, we find things that we relate to. One of the most poignant parts of writing and publishing the book for me has been the people who reach out to me who say, "I have never struggled with addiction and haven't really understood it. And I was surprised by how much I could relate to you in the book." That they could relate their own, maybe they struggled with a little anxiety or whatever it is, that they understood it in a different way. And, that's the goal. The goal is that we talk about these things openly, that we are able to have conversations at the dinner table really openly about addiction. I'll just end on one really quick thing, is that my father, when he first found out that I was a heroin addict, was so horrified. He was a public-facing CEO of a Fortune 500 company, and this was really just his worst nightmare, and didn't want anyone to know. We weren't supposed to talk about it, etc. And you cut to today, and whenever somebody comes to, he meets somebody new, they're at dinner at his house, they're talking about, "Oh, what do your kids do? Da da da." He tells them about me, tells them about my story, my book. Says, shows them the review in the New York Times, and it's just interesting that, this is proof of why it's so important to have these discussions, why it's important to write and speak on it, because it opens people's minds, and then they're able to discuss it, and it becomes less scary. And when it's less scary, then we are able to have those conversations with our kids, etc., to keep them alive.
Yeah. Wow. So well said. Thank you so much for joining us today, Erin. And thank you for joining us on the Well Aware podcast. I hope you found this discussion as interesting and insightful and helpful as I did. You can definitely find out more about Erin. Check out her book, again, called Strung Out, One Last Hit and Other Lies That Nearly Killed Me. And if you like reading shorter things, definitely check out her column, Ask Erin, on Substack. It is wonderful. It's just like Dear Abby, but modern day. It's great, and it's super funny, super empathic as well. So again, thanks for joining us today. Follow us on social media. And most importantly, remember to do something nice for yourself today. Take care.